Grinding your teeth or brushing too hard can cause something you don't want, receding gums. It's a problem that can also lead to tooth decay. Dr. Joe now telling us about a newer, less painful fix that'll leave people smiling.
Joe, we're in lucky room number 4 here.
Jill Frederick dreaded getting her teeth cleaned.
It was horrific. It was so painful, and I was like, every time she'd hit her nerve.
Hot and cold foods made Larissa Jones cringe.
Ice cream, this is just very sensitive.
Skipping regular cleanings took a toll on Barbara Nash.
I admit that I hadn't been getting good dental care.
The stories differ, but these women all have one thing in common: receding gums.
People get sensitive teeth, they're losing bone as they have more gum recession, and eventually they can lose their teeth.
Periodontist Dr. Bruce Crawford says one way to fix the problem is the Chow pinhole surgical technique.
If you're 75 years old, we can bring your tissue back like it was when you were 16.
In these before pictures, you'll see a dark area. That's where the gum line has receded and the root is exposed.
There's no enamel on the root, and so they're softer, more susceptible to getting cavities.
In this animation from the company, you'll see how traditional procedures transfer tissue from the roof of the mouth to exposed areas. Pinhole surgery instead drops the gum line back down to its original place by cutting connections beneath the gum.
So the gum tissue we're able to move, so it's kind of attached real firm like this, and by the time we're finished, we can move it up and down.
Collagen strips are inserted through pinholes, helping gums heal in place. Barbara's procedure was 2 weeks ago.
You see a little bit of the irregularity right here. That's where we place the material through, so the material will dissolve or resorb over a period of time.
Jill's procedure was 3 months ago.
Fantastic, because when I take my tongue and touch my teeth in the back, I feel gum versus ridge, a ridge of a tooth where the gum has receded.
Larissa's again spending time at the ice cream shop.
It was great. It was great. Probably too good.
She's also happy with how she looks. You can see the change in her before and after photos. Changes that Larissa hopes will last a lifetime.
I don't consider it as a cosmetic, but I consider it more of a preserving my gums, preserving my teeth, and having them hopefully for a really long time.
Now, pinhole surgery costs start at about $1,800 for small areas, and if needed can cost several thousand for a full treatment. It may be covered in part by dental insurance. Now, Dr. Crawford says if you're considering the procedure, he advises you get it done when the problem is less advanced. Cynthia, that could help save you a tooth and a lot of money.
Yeah, a lot of grief too. Sure sounds that way. Thank you, Dr. Joe.